We begin with the latest on the overdose crisis plaguing communities all across the U.S.
It's killed more Americans in a single year than the wars in Vietnam, Iraq, and Afghanistan combined. 100,000
Americans died from an overdose in 2021, often and without knowing, from fentanyl. Often there are kids who didn't know they were buying the drug.
Did Landon have a sense that he could be buying a pill that would be laced with fentanyl?
I don't think he even recognized that that was going to be a possibility.
And as more illicit drugs lace more pills, Marin County is desperately trying to anticipate any new poisons entering that deadly marketplace. And as Brian Hackney shows us, they're doing it in a completely novel way.
Marin County, scenic, rustic, troubling. Drug-related fatalities here have doubled since 2020. Fentanyl alone accounting for 57% of those deaths. Experts are using a novel technique to flush out the reasons. Let me explain. When a toilet is flushed in Fairfax, it mixes with 8 million other gallons and 10 hours later ends up here.
This is the regional treatment plant. Water comes in this building. It gets screened, abrasive materials removed, then the water flows through these tanks here, through those towers, then it discharges into a 7-foot diameter pipe that goes 2 miles out in the San Francisco Bay. Thank you.
You're welcome.
But something novel is happening inside this room.
So what we have here is the sampling pumps, and these pumps then pump the water into these samplers.
And what are they looking for? Anything related to overdose,
including opioids, methamphetamine, fentanyl, cocaine, as well as nicotine.
This is Haley Hanna. She's used 911 calls to track illicit drug use.
These are data from our 911 substance use surveillance system that we run every week.
Hello?
They try to correlate 911 calls with overdoses. But this new tool literally pulls data from 50% of Marin because, as we know, what goes in must come out.
And if you used drugs, then there will be a particular metabolite of that drug that will show up in the wastewater.
It allows health experts to get a heads up on any more dangerous drugs entering the pipeline.
We're now seeing other drugs like xylazine and tranq that are coming into the drug supply. So these data could give us an early warning sign that something like that is in the drug supply before we have any clinical signal.
So 100,000 people are anonymous participants in a big drug use experiment with a potentially big payoff.
We see each overdose as preventable, and we want to do all we can in terms of trying out these new innovative tools to make sure that we reduce as many overdoses as we can.
We'll know more in 6 months when the first results roll in.